Now, alopecia areata is a disease that happens when the immune system attacks hair follicles and causes hair loss. Hair follicles are the structures in skin that form hair, while hair can be lost from any part of the body. Alopecia areata usually affects the head and the face. And of course, joining us in the studio is Dr. Sylvi Kapundja, who will elaborate more on that. A very good evening to you, Doctor, and thank you so much for being here.
Hi, Milka. Thank you for having me.
So, first of all, what are the common causes and risk factors that are associated with alopecia?
Okay, firstly, let me just correct the opening statement.
Right.
So, it's not necessarily an autoimmune, that is just part of some alopecias. Some alopecias can be caused by ourselves. And some causes are like, tight hairstyles, which cause traction alopecia and things like that. And also some chemical reactions, relaxers, hair dyes, and things like that can also cause alopecia, or rather hair loss, which is used alternatively as the word alopecia itself.
Right. So how does one distinguish the different types?
Okay, so clinically, when you visit your doctor, we like to classify alopecia as scarring and non-scarring. So scarring, saying that the hair follicles, as you've mentioned earlier, are completely damaged, and that's when it gives us the notion that this alopecia is probably autoimmune. It's basically your body in itself attacking the hair follicles. Or if it's non-scarring and the hair follicles are still there, then we can entertain other external factors like, chemicals, traction alopecia, like tight hairstyles, or, postpartum alopecia, which has to do with your hormones and at what stage the hair cycle is.
So during a typical diagnosis, what tests may be involved?
Okay, so usually first, you can just, do a blank eye on the patient. You can literally see it, if there are hair follicles or not. If the scalp looks a bit more shinier, then it should literally looking like a scar, then that's what scarring alopecia is. And if there are small bumps that look like little pimples, those are our hair follicles. But most of us who deal with hair problems on a daily, we have instruments called dermoscopies or dermatoscopes in our practices that we use to magnify and also look at the scalp in greater detail. But the accurately gold standard diagnosis should be the scalp biopsy, which is when we take a piece of skin and we send it to the lab.
Right. So would you say there are available treatment options for alopecia, both medical and non-medical?
100%, especially on the medical side. It's a manageable disease. When it's autoimmune, there's no cure for it because it's basically your body itself destroying itself. However, we can control it and treat it and, keep it under control so that like your hair either grows back or you stop the process of losing the hair. And if it's, self-inflicted, like, we like to, put on our braids a little bit tight or wear our wigs a little tight as women. We can always change our lifestyles and, yeah.
Talking about lifestyle changes, I mean, talk to us about some of these lifestyle changes. Talk to us also about some home remedies, perhaps, that can help to manage alopecia.
Okay, so I like to tell my patients that treat your scalp the same way you treat your face. Take care of it, wash it regularly, get the right products to use on your scalp. There are different types of shampoos, different types of hair lotions and hair treatments we can use for each type of scalp. The same way, we have oily, non-oily skin and things like that. So those are some lifestyle changes you can do at home. And the other things is just for us ladies, let's relax on the traction and pulling our hair so that we don't pull out our hair from its roots and then, cause permanent damage. In terms of hormonal balances and things like that, we always start by exercising. Regular exercise, have a good diet, try and have a balanced diet, try and eat a home-cooked meal every now and then. It goes a long way.
So it's not something out of the ordinary that people have to do.
No,
they just have to manage their lifestyle.
Yes, manage your lifestyle, manage the products that you use, the barbers, make sure everything is sanitary, because you know you don't want to get infections, then you get a scar, then you don't grow hair anymore. But in terms of aging, like male pattern baldness and women pattern baldness, it's a common thing. We can try and slow it down because it's a natural way of aging. However, there's not much you can do at home without the help of a doctor.
A very important question. Does the hair grow back?
Yes, if it's non-scarring alopecia,
Right.
it does grow back. So yes, there is hope.
So what can individuals do to prevent or to minimize the progression of alopecia? Just in closing.
Just in closing, the moment you see that your hair is thinning, it's becoming less, or you see a bald spot on your head, or you feel like your sideburns are, receding, or your hairline is receding a little bit, go in there, look for a doctor who, treats hair like myself, or, your nearest GP. Go in there, get a consult, or refer you. We always call each other, and we'll definitely, step in at the right time. So the earlier, the better, especially for the postpartum women, for the women who just delivered. Some women tend to shed hair, and it's known as telogen effluvium, which is some type of alopecia as well. So visit your gynae, they'll educate you on that as well.
Thank you so much for speaking to us and for emphasizing there that prevention is better than cure.
100%.
Thank you.
Thank you.
Well, of course, Dr. Sylvi Kapundja, who has been talking to us about alopecia areata, which is a disease that happens, for various causes. You heard it there. Prevention is definitely better than the cure. Well, the Daily Roundup will continue, so don't go too far.